sign up for public comment to address the board that was not asked many times. As I have not been invited to any discussions in the past 2 weeks regarding the budget for the health department, I'm not sure I'll be invited to speak later in this meeting. County Public Health provides an array of services and education programs required by law as well as local need. To receive funding from state and federal partners, they must 1, meet minimum funding requirements, and 2, meet minimum service levels. Failure to meet either of these requirements risks loss of state and grant funding for the local health department. This could lead to legal action or state intervention. I'm glad to say this latest version of the budget meets the maintenance of effort requirement for some programs, but still some funding and legal problems exist with the budget proposed. Administrator Gibbs' instruction 2 weeks ago was to create a budget cutting the general fund contribution to the health department down to $2.5 million, over a 60% reduction from the budget I submitted in May. And it would have resulted in the health department not meeting minimum funding level or minimum service level requirements. After attempts to communicate these concerns to Administrator Gibbs went nowhere, it was important that I be transparent with the rest of the Commission and the public and communicate the risk to public health if funding moved forward at $2.5 million. Certainly, a funding cut at the level of the health department can no longer operate as a threat to the public health of our community. Administrator Gibbs moved forward instructing that fiscal services drop a budget without public health input. I was provided that budget, the budget that you're discussing today on Friday afternoon. This did not allow enough time for me to completely determine what the proposed cuts mean for services. But it seems at some point you realized I was telling you the truth. The health department could not operate on a general fund contribution of $2.5 million, as the amount now in play is just over $4.3 million, nearly $2 million more than the budget I was asked to create. This amount is still far less than is needed to provide our core services, an amount that was determined through the normal budget process with fiscal services and public health. The same process is followed by all other departments. In today's version of the budget proposed by Administrator Gibbs, there are cuts to immunizations, STD testing and prevention, communicable disease investigation and prevention, and health promotion programs. Health promotion includes suicide prevention programs, substance use prevention programs, and food assistance for individuals, families, and children. Today's version of the budget also reduces the amounts of Smiles Dental program for uninsured children. In some instances, you are literally taking services out of the mouth of children with these actions. This is not a return to pre-COVID budget levels, since it results in cuts to services and positions that existed pre-COVID. I was asked to be here today by Mr. Gibbs, which I'm happy to do, and I hope that you will ask me for input as we discuss this budget. Thank you.